Good afternoon. My name is Tom Donovan, and I welcome you to the public hearing on the proposed merger between Concord Regional VNA and Central New Hampshire VNA. I serve as the Director of Charitable Trusts in the Attorney General's office, and I have the responsibility to review proposed transactions between healthcare organizations, including this one. We encourage, as part of the process, substantial public participation and comment. This hearing tonight is an opportunity for everyone to learn about and comment on the transaction between the Concord Regional VNA and Central New Hampshire VNA. Now, I would like to introduce our moderator, Martha Teca.
Good afternoon, everyone, and thank you for joining us for this informational hearing today. I am Martha Teca, and I'll be your moderator. Please note that this session is being recorded. As we've just heard, the hearing provides an opportunity for the public to learn more about the proposed merger of Concord Regional VNA and Central New Hampshire VNA and Hospice, to ask questions and to offer comments. Before we begin, I'd like to provide you with a few details about logistics. For those of you who joined using the Zoom link, your camera and microphone are automatically disabled. You'll be able to see and hear the panel, but we cannot see or hear you. We'll begin the session with a brief presentation, about 20 minutes, followed by the question and comment session. I'll explain how you may ask a question or make a comment when we get to that portion of the program. I'll note now that one of the options is to write a message in the chat box. You can do that at any time during the presentation or during the question and comment period. If you're logged on through a laptop or a mobile device, you may select the Zoom view, which works best for you, either a gallery view or a presenter view. You can toggle between the two options in the right-hand top corner of your screen. It may help you see the presentation or the presenter a little better, depending on which view you prefer. Again, this session is being recorded. It'll be made available afterwards for public viewing on 2 websites. I'll read those website names now for the sake of the recording, and we'll post the links in the chat box during the program at different times during the program, so you'll be able to catch the link there as well. You'll be able to access the recording at the Charitable Trust website. That is doj.nh.gov/charitable-trusts. It's also available at vnaforthefuturenh.com. That's just one word, vnaforthefuturenh.com. Again, we'll post those links later for easy access. Now I am pleased to introduce today's presenters. Kevin Stone is Senior Consultant at Helms & Company, a Concord-based healthcare consulting and management firm.
Hello.
Melvin Severance is Chair of the Concord Regional VNA Board of Trustees.
Hello.
Kristen Gardner is President of the Central New Hampshire VNA and Hospice Board of Trustees.
Good afternoon.
Beth Slepian is CEO and President of Concord Regional VNA.
Hello.
And Lisa Dupree is CEO of Central New Hampshire VNA and Hospice.
Good afternoon.
Thank you all for being with us. I'll now turn over the session to Kevin Stone, who will discuss the background, rationale, and benefits of the proposed merger. As a reminder, we'll receive comments and the panelists will respond to questions after the presentation. Kevin?
Thank you, Martha. Next slide, please. So the home care industry, like much of healthcare, is in a challenging environment. At the start of this year, before the pandemic hit, Medicare implemented a major system payment change for home care agencies, the patient-driven grouping model. Generally, home care agencies receive about 50 to 75% of their revenue from the Medicare program. So a big payment system change can be daunting to these organizations. Additionally, Medicare is eliminating the request for anticipated payment program, and this will reduce the cash flow benefits to home care agencies. It's been about 20 years since Medicare did a major payment change, and the last time they did, there was about a 25% consolidation in the industry that resulted. In addition to the Medicare changes, we've seen growth of the Medicare Advantage plans. You've probably recently saw a lot of advertising on TV, Joe Namath touting Medicare benefits, and this is talking about Medicare Advantage plans. Nationally, about a third of all Medicare recipients now are enrolled in Medicare Advantage plans. And the dilemma for home care organizations is each one of these plans has its own contract, has its own approach to payment, and has its own administrative requirements. So the burden for home care organizations to deal with so many organizations has gone up considerably with the growth of Medicare Advantage. A second trend has been the ongoing consolidation of referral sources, physicians joining hospital systems, hospitals joining multiple hospital systems, and really all around the goal of creating an integrated delivery system. And the result of this is these systems tend to have a larger geographic footprint, and they have more clinical service breadth, and they're looking for a home care relationship that's relatively easy for them to work with and that can provide coverage to all of their patients, both clinically and geographically. They're looking for the one call solves all relationship. And many of these organizations and their providers either are or belong to accountable care organizations or have direct payer contracts with total cost of care, where they're concerned now with all of the costs of care provided to patients, not just the cost of those providers may render directly. So the good news is this makes them more interested in home care because home care renders services in a very low cost setting, the patient's home. But it also means these systems now are more concerned about a home care agency's ability to take patients under care, to have appropriate clinical breadth, to handle a greater array of patient conditions safely in the home care setting. Next slide, please. In addition to these national trends, there are a couple others here in New Hampshire that I think are particularly impactful. We have had sort of a shrinking healthcare workforce and an aging workforce, particularly acute with nursing. I think the average age of a nurse in New Hampshire now is over 55 years old. And the shrinking pool creates contention for hiring workers. Historically, home care agencies are not the top payer of wages, so it can be challenging to be able to recruit and retain a steady workforce. Overlay all of this now with the impact of the COVID pandemic that has really stressed the healthcare workers, and it's really a big issue for all home care agencies to try to maintain a stable workforce. The other factor is, over the last few years, the financial difficulties faced by the Lakes Region healthcare system. Despite efforts, they have been unable to find a partner and have been in bankruptcy proceedings. And I understand that it was announced today that Concord Hospital may be the bidder that ends up with the Lakes Region system. But this has led to patients migrating out of the Lakes Region, and many have gone to Concord. Concord has a very sophisticated healthcare delivery system at Capital Region Healthcare. And if patients are going to leave their local community, they're going to be attractive to go to where there's a high degree of medical sophistication. Additionally, Lakes Region closed down some services like maternity, and that compelled patients in the Lakes Region area to seek care out of their community. And this has resulted in some market shifts. And the Central New Hampshire Board actually commissioned a market share study looking at changes in Belknap County over the last 5 years. And it showed a significant trend towards patients moving from the Lakes Region to Concord. So the trustees of both organizations considered all the implications of these factors And they concluded that the two organizations have compatible purposes and cultures, and they could best fulfill the shared mission of serving this larger community by coming together. Next slide, please. And I was asked to comment on the benefits of the proposed affiliation, and they really fall into two categories. One is the opportunity to improve the overall organizational stability, both financial and clinical, to allow these organizations to continue to offer high quality services. Together, they should be able to share administrative services that can spread a fixed overhead cost over a greater volume, and that should lead to reduced overhead cost per visit and less overhead as a percentage of revenue, more money being then available for clinical care. I note that the organizations will need a common electronic health record to realize a lot of these opportunities, and the organizations have plans to pursue this. Another opportunity will be improving resource use, particularly around facilities, to delay or perhaps avoid altogether the need for one organization to expand its facilities when another one may have adequate space that could accommodate their needs. But I think the biggest opportunity will be in the area of employee training, education, really together being able to create better ways for the healthcare workers to meet their career goals and their career growth goals by staying within the combined organization. And they'll also be able to reduce the fragility of some services. Both organizations have some subspecialty clinical care, but there are not a lot of clinical FTEs that render that care. Together, they'll have more folks that can provide coverage to vacations and can step in when there's needs to cover unexpected illness. Next slide, please. The other area of benefit concerns enhanced community services. The organizations will be able to expand some of these clinical services to a greater territory, bigger geography. Concord has had a stable palliative care program for a number of years. Central New Hampshire has been starting to develop a palliative care program. Together, they should be able to do a really good job of creating a combined palliative care program. Similarly, in behavioral health, Concord has had some resources, some of which were obtained through a grant, and those resources now can be expanded to serve the Lakes region. Concord also has had a lot of investment in resources in community education and community programs, and those also can now be broadened to serve a bigger population. Together, the organization should be able to have an improved ability to handle referral requests from wherever, whether it's Lakes region or Concord. And by coordinating the scheduling of their combined clinicians, they should be able to reduce clinician travel time between patients. And that can really help improve overall productivity, which is an important element of financial performance. They also should be able to create a coordinated intake program and stabilize a reliable after-hours coverage system. So together, I think these organizations will be well-positioned to serve the needs of patients, whether they get care from Lakes region or Concord or both, and can provide relative ease for providers and patients, but always with preserving patient choice. Next slide, please. And then finally, there's been a lot of growth of for-profit organizations in home care and hospice. These organizations can do a great job of providing clinical care, but their purpose is to maximize financial gain. And I think having a stronger nonprofit VNA in the Capital and Lakes region will be good for New Hampshire healthcare, where the community has a voice in the governance structure, and those individuals are responsible for making resource allocation decisions around community need and not profit maximization. And this can allow the organizations to best preserve service offerings, some of which may not cover their costs, but which are consistent with the mission of community service and patient care. And with that, I would like to turn this over to Mel Severance, Chair of the Concord Regional VNA Board, and Kristen Gardner, Chair of the Central New Hampshire VNA and Hospice Board.
Thanks, Kevin. What I'd like to do for all the folks online this afternoon is to provide you with a timeline and a little bit of an overview of what the Board of Trustees did in both organizations in order to bring us to this point. Back in September of 2019, the chairs of both organizations and the CEOs had a meeting to discuss the potential benefits of any kind of a collaboration. And after a thorough discussion, that was brought back to the subsequent trustees of each board to determine what would be the benefits of a long-term cooperation. After kind of a thorough discussion, much of which you just heard from Kevin relative to the outcomes, they decided to form trustee work groups. And in November of 2019, the work group met to discuss many of the situations and the conditions that Kevin addressed. But primarily, we were focused on cultural suitability and whether or not the personality, if you will, of each organization could be blended easily and make for a better and stronger organization. We brought that information back to the board and of trustees in each of our subsequent areas, and they considered to move ahead, or they had said that it would be fine to move ahead. And in December 17th or so, we had a financial review of the organization's community education benefits and affiliation goals. We found that there was a great deal of compatibility and capability in the both organizations. And so in February, we met again to discuss management issues and get into a little more fine tuning, and brought that back to the board, and the board said, let's continue to go, and reviewed a lot of documentation, and the boards unanimously voted to enter into a non-binding letter of agreement in March. And what was interesting is obviously, as you're all aware, that's when COVID hit us. And now we're all working remotely. And in June, we had a public listening session to see what the folks in the community thought about the potential of a merger. And then June, July, both boards approved the definitive agreement to be filed for a change of control. And that's what has brought us to this point. And all through those interim meetings, we validated with each board the ability to work together. And Christian, I'll turn it over to you.
Sure. I just want to support what Mel has said in that the whole process has taken us a little over a year, but the work committee, the trustee work committee, definitely had the full support of their respective boards. We found that we had not only a common mission, but common goals. The boards have actually even come up with a new mission statement that was actually, we were able to do that very quickly, that just shows the compatibility between the two organizations. One of the things that I think is, a positive in this situation is that both organizations are coming from a position of strength. Neither one of our organizations is in crisis. We feel that both organizations have things to offer in terms of staffing and financial resources and community support, and that we're going to come out of this as one entity that's going to be even stronger to weather a lot of the things that Kevin discussed, which are, the payor situation, the shortages in nursing, the aging workforce, and we just, as the central board, feels that this merger is definitely going to be beneficial to the community in the Lakes region, as we will be able to provide more services and be more stable. So now do we go back to Lisa and Beth, I believe?
Yeah, so next slide, please. So the leadership here at Central really feel that this merger will enhance the provisions of our mission and services to the community by adding depth of resources and by making sure that we're sustainable far into the future to continue to provide the services that we do, even with all the changes that are happening. We also feel that it will enhance community education and our wellness program offerings and access to all of the communities that the combined entity will service. It will help us also attract and retain a strong workforce with competitive wages and comprehensive benefits. It will also help us perpetuate nonprofit home care and hospice access for Central New Hampshire's most vulnerable populations. Next slide.
For Concord Regional VNA, it will really allow us to continue our mission of providing exceptional and innovative care in an expanding footprint as requested by our referral sources. In partnership with Capital Region Healthcare and as Concord's Concord Hospital and Concord Hospital Medical Group reach into the community has expanded into other physician practices, we have been asked to expand our services, and it does become more difficult as the staffing situation becomes more challenging. So by merging with Central New Hampshire, we will really be able to utilize the depth of staff in an expanding region. We've really been committed to protecting community investments. So the investments that are currently part of each organization will be maintained and used in the communities in which they were raised. And for any organization, it's really the balance between volume and scale for sustainability. We are a large organization. We are a low-cost provider in the state and are able to leverage our scale. But as reimbursement rates lower and the cost of our workforce increases, volume becomes very important for us to be able to sustain. And coming together as two organizations, we'll be able to balance those two things. Again, we're committed to our workforce and providing opportunities for growth and development. And we really look forward to a collaborative relationship, strong alignment, and melding of cultures. The work of the Joint Trustee Work Group has been tremendous. And as we worked through governance and other areas, they really showed a vision and the ability to bring the cultures together into one larger and stronger organization. Next slide. These are our current service areas that are served by both organizations. Next slide. And this is what the combined service area looks like. So you'll see in the red area, that's where we overlap, and we'll be able to really leverage our staff in the entire service area and bring our specialty programs in a more efficient manner. Next slide. Lisa?
I'm unmuted now. So I would like to thank everybody who participated in this public hearing and for hoping for a lot of comments and questions and support for our merger. Thank you to Martha as our moderator and to the other panelists. I'd like to turn it over to Beth for any closing comments.
This has been very exciting for both of our organizations, and I think the last 9 months, as we have been in the front lines of the pandemic, has really also showed us that the collaboration and the coming together of the two organizations will really further help serve our communities as we move ahead. Thank you all for joining us.
Well, thank you to all of our panelists. Thank you, Kevin, Mel and Kristen, Lisa and Beth. We're going to now begin the question and comment portion of the program. And here's how it's going to work. To accommodate all of the attendees who may wish to speak, we ask that you keep your question or comment to 3 minutes or less. If you have a follow-up question or comment, you may get back into the queue and we'll do our best to get back to you. When asking a question or sharing a comment, please state your name and your town of residence. Now, there are 3 ways that we'll be receiving questions and comments. If you're with us online on your computer or your smartphone, you have 2 ways. To speak your question or comment, click the raise hand feature. That appears at the bottom of the participant frame. You can click on participant at the bottom of your screen on the black bar, white frame will pop up with participants, and you can click raise hand there. I'll see the raised hands in the order that they're received. And then when I call on you, you'll unmute yourself on your Zoom window and then ask your question or make a comment. Your camera will still be disabled, but all the attendees and panelists will hear you. When you're finished, your microphone will be muted again. Online, you can also submit a question or comment, as I mentioned earlier, using the chat feature. Your question or comment will be sent to me and I'll read it out loud to the panelists live so that all attendees can hear it. Please be sure to include your name and where you're from in that chat message. If you're joining by phone, you can raise your hand by pressing *9 on your phone's keypad. Then you'll get placed in the same queue with the folks who are already online. When you're called on, you'll hear a short message and then you press *6 to unmute yourself. So that's *9 to raise your hand and get in the queue. And then when you get called on, *6 will unmute yourself. Once you ask your question or make a comment, you'll be muted again. I think you'll see how it works as we go forward. So let's get started. I'm gonna check and see. First, I'm going to start with the message that have come in in the chat. And this is from Gina Chiaro, and I'm sorry if I mispronounce names. As a recent past board member and president of Central, I just want to add my absolute support for this endeavor and coming together. In my day job, I'm a local church pastor, and I know well the needs of the small communities around the lake. Our families rely on excellent, stable, and reliable access to health care. Not all of the resources in our area are equally skilled and excellent, and I'm excited that this merger will bring more resources to our towns. Gina is from Wolfboro. And if anyone else has a question or comment, feel free to add it in the chat or raise your hand if you are interested in speaking a comment or question to any of the panelists. First, with a hand raised is Mark Edelstein. And you'll be the first, you'll be unmuted. Go ahead, Mark.
Okay, I unmuted.
You did.
I live in Laconia. I'm a retired president from Lakes Region Community College. And I've served on the Central Board for the last 4 or 5 years. I went into this process with some concerns because always when a larger organization is merging with a smaller organization, the smaller organization has to be really careful to ensure that it's not simply being swallowed and overrun by a larger organization. But I was very, very impressed by our ability to work together. I served on the work group. It was a very, very collegial interaction. Very professionally done. I came to have a great deal of respect, not only for Beth, but for my colleagues on the Concord board. And it was a much easier, a smoother process than I could have imagined. And I think we all left it with a very positive feeling and a great deal of hope for the future in terms of our ability to expand our services to all of our communities.
Thank you, Mark. Thank you very much. The next hand raised is Christopher Parkinson. Christopher, You may unmute yourself.
Hi, I'm retired and I live in Moultonborough, New Hampshire. I was a former COO of CS1, which is a subsidiary of Northeast Delta Dental, and I'm a former trustee of CRVNA, and currently on the investment committee of CRVNA. And I've attended this session in June, and I think it's a great opportunity for both organizations, and I'm fully in support of it.
Thank you very much for your comment. There's another comment in the chat. This is from Daniel Andrus. Daniel Andrus from Bow, and I am a member of the Board of Trustees of the Concord Regional Visiting Nurse Association, and I wish to speak enthusiastically in favor of this merger. Anyone else interested in sharing a comment or question? Well, you're maybe thinking about that. I'll just share a couple of quick ones that came in online during registration. Folks had the opportunity to include a comment. There's a comment from Michael Donahue from Canterbury that says, I support the merger and continuing mission of the CRVNA. Lisa Sglody from Dartmouth Hitchcock in Concord asks a question that our panelists may be able to respond to. Will there be marketing and education material available to the public and referring providers regarding services?
Hi, Lisa. Thank you for your question. Certainly, as we receive approval from on the merger and the transaction and we move forward, we will be providing everybody the information they need to understand what services we'll be providing, where we'll be providing them, and we will make the transition as easy as possible for all of you. So thank you for participating.
We got one more online beforehand, and this is from John Getz from Merrimack, and he says, I support this merger. At this point, I don't have any more folks with hands raised or any additional. I'm just making sure I didn't miss something here. Wait a minute, did get just a couple more messages, great. This is from Robert Stickmeyer to all panelists, all of us. We have in Concord a close working relationship between the CRVNA, Riverbend, and Concord Hospital. All three organizations work very closely together with the patient at the center. It'll be very significant to continue this model to serve the broader region. I strongly support the merger. Lynn Painter is a trustee from CRVNA living in Concord. I've been impressed with the thoroughness and care with which the joint board committee approached this merger, and I wholeheartedly support the merger of these two valuable organizations. Micheline Dufour of Concord, who's a trustee of CRVNA. I want everyone to know that both organizations took this potential merger incredibly seriously. I served on the trustee work group, and it was countless hours of comprehensive conversations on part of both organizations. And we'll wait just a minute or two because I know that it does sometimes take time to compose a chat comment. We want to make sure if that's how you're deciding to choose your. Okay. From Ann Diefendorf. As a longtime member of CRVNA Quality Committee, I support the merger and look forward to the outcome of joining two great organizations. From Jennifer Lgasse. Jennifer Lgasse is Hospice Director and Chief Clinical Nurse for Central New Hampshire VNA and Hospice. I've been with Central for over 15 years, and much of those years I've had the pleasure to work with Beth and various other staff members from CRVNA on community education projects as well as state boards. I'm excited for this venture and look forward to continuing to provide high quality care for our many communities as one VNA. Anyone else? Anyone want to put your voice out there or type in something? How do folks feel? If there's, or do we think, it sounded to me like a very thorough presentation of what was happening, and we've had a number of comments. Or would you like to wait a little longer for folks, or Tom, what do you think?
I'd say this is last call. Martha Teca has said, given the 2-minute warning to everyone. So please, if you'd like to either use the chat feature or otherwise speak up, this is the time. Otherwise, we can wrap this up.
Okay, thank you. We did actually just get one more here, and again, we're not in a rush, but we just, if I agree, last call is a good way to think about it. Randy McDonald, coordinator of volunteer services for Central VNA and Hospice, having had friends and family in both service areas, looking forward to the merger. I think we're probably in good shape here. Okay, Lisa or Beth, would you like to say any final?
I just want to thank everybody for their hard work. You know, the trustees, the community, and all of your support has really propelled us into a very bright future. So thank you all very much.
I'd also like to thank everybody for taking their time this afternoon to participate. It was great to hear a lot of the positive support as we move forward, and really exciting as we move to become one.
Tom, any final comments?
Yes, if we could put up the final slide there, that would be good. Thank you to Beth, Lisa, Mel, Kristen, and Kevin for providing us with this informative presentation today. And thank you, Martha Teca, as our moderator. I think you did a good job handling the technology and getting the comments out. We appreciate the written comments as well as the spoken comments today and the questions. That input is important to our process as we review this transaction. But if those of you who are shy, didn't feel you were ready to make a comment, you still have time. So as you can see on the screen, you can email us comments to charitabletrust2@doj.nh.gov. And you can get more information about the transaction, the documents, at our website, which is also on the screen you can see. You can also find out more or leave comments at vnaforthefuture.com. So as Martha mentioned earlier, the complete recording of this listening session will be posted on our website or on vnaforthefuture.com. So thank you again. Stay well and enjoy the rest of your evening.